Hi, my name is Denisha Atkins, and in this video, I will be discussing the case study involving the patient JS. JS is a 50-year-old woman who was brought to the emergency room by her husband after she became lightheaded, confused, and so weak she could not even dress herself. Upon her coming to the hospital, her lab values were found, indicating a glucose value of 68, which indicates hypoglycemia. Her calcium level was 9.2, which is within a normal range. Her sodium level is 130, which indicates hyponatremia. Her potassium was 5.5, which indicates hyperkalemia. Her bicarbonate is 25.4, and that is also within normal limits. Her chloride was 93.5, and that also indicated hypochloremia. And her cortisol level was 4, and that indicates adrenal insufficiency. All of these lab values, they are signs and symptoms of adrenal insufficiency, and also the hyponatremia and hypoglycemia could be the result of why she's so confused. Other assessment findings could be used to diagnose adrenal insufficiency. For example, the clinical manifestations of adrenal insufficiency are fatigue, weight loss, anorexia, orthostatic hypotension, salt craving, nausea, vomiting, diarrhea, and abdominal pain. Other findings may include anemia, low urine cortisol levels, or low adrenocorticotropic levels. They might also have increased bone levels, or if an EKG was done, it might show peak T waves from hyperkalemia. It was mentioned in the case study that JS recently stopped taking the corticosteroid prednisone. She couldn't afford the medication anymore, so she stopped taking it a few weeks ago. Well, a steroid helps the adrenal glands produce or secrete cortisol. So when she stopped taking the medication, the production of cortisol slowed down and eventually it stopped, so that led her to have adrenal insufficiency. So that's why it's very important to teach the patients that when they are taking a medication, that they don't stop taking it without talking to their doctor, and that the doctor teaches them how to taper off the medication so they won't have these kind of problems once they're off of it. The next question asks is, would JS's adrenal insufficiency be considered to be from a primary or secondary cause? Well, because JS stopped taking the corticosteroid medication prednisone, this will be considered a secondary cause. The adrenal glands are not producing cortisol because she stopped taking this medication. So it's a secondary cause. But if she was having another problem like Addison's disease, where the adrenal gland cells were deteriorating or destructive and they couldn't produce cortisol, that would be considered a primary cause. So that's pretty much the difference with that. Nursing care for JS includes a few different things. The first thing is to make sure that she has replacement therapy available to her once she goes home. It's very important that patients have the medications they need. This patient is taking prednisone for a rheumatoid arthritis, so we should definitely consult with a case manager to make sure that she has the medication once she, goes home. The next is to have an IV placed so she can receive the steroid through her IV to raise her cortisol levels as soon as possible. The next thing that she needs to be treated for is hypoglycemia. She has a low blood sugar of 68, so that can be treated with we can give her something to eat, like peanut butters and crackers, or a a sandwich or something like that to raise her blood sugar. We don't want to give her like orange juice or apple juice because that will just give her a spike in her blood sugar without maintaining it. We also need to be treating her for electrolyte imbalances. She does have a very high potassium, and high potassium can be very dangerous and affect the heart. So we need to be doing something to take care of her potassium levels, possibly give her Lasix or another medication that can pull some fluid off and get rid of some of that potassium. Additional teaching for JS is to really instruct her to take her medication every single day as prescribed by her doctor. And many older patients, they will stop taking their medications because they can't afford it or their spouse needs the medication, so it's whoever feels the worst on that day. But we really need to teach our patients not to do this if they can help it. We can provide them with additional resources. They can talk with a social worker, and we can find them resources to assist them with the cost of their medications so they won't discontinue them when they can't get them. Patients who are taking steroids or other medications need to be tapered down before they just discontinue them. So they need to talk to their doctor before they do this as well.